An estimated 18 million Americans suffer from this condition, obesity. Today we're going to speak with Dr. Michael Bono, who is a bariatric surgeon, and we're going to discuss this a little further. Thank you, Dr. Bono, for joining us.
Thanks for having me.
Well, Dr. Bono, first of all, for people who are watching, what is bariatric surgery?
Bariatric surgery is the treatment of the allied diseases associated with obesity.
Which is?
The being overweight. And there are different levels of being overweight, and surgery isn't the proper treatment for each level. The easiest way to calculate where you stand in regards to obesity is the body mass index, which is basically your weight over your meters squared. When a level reaches over 35, that's what we call morbid obesity.
Okay.
Below that, you have obesity, overweight, and being lean. Morbid obesity, on average, is about being 100% or 100 pounds over your ideal body weight. The long-term studies show that these surgeries benefit these patients. These surgeries have been around for over 50 or 60 years.
Okay, and what surgeries are we talking about? What is the most common one used now? There are many different types of bariatric, but what is the one that is used right now that you prefer?
We went through, our society has gone through a litany of surgeries, but the three surgeries that are most popular right now are the Roux-en-Y gastric bypass, the banding procedure, and now also the sleeve gastrectomy. And all three of them, in the right patient, have good long-term and short-term results, can get rid of a majority of your comorbidities, and we enjoy doing it in this region.
Okay, so there are benefits from it as well as risks.
Yes. The main consideration for someone who wants to look into doing one of these surgeries, do the benefits outweigh the risks? And once you reach that point, we talked about the body mass index over 35, 100 pounds or 100% over your ideal body weight, the benefits outweigh the risks. Your risk level of not undergoing surgery is higher than undergoing surgery. And that's the patients we work up and we proceed to operation.
Okay, and in the recovery period, then does the patient just maintain the way they used to eat, or is there a special diet involved? What is the protocol for that before and after with the patient?
That's a big question. We follow a pretty detailed pre-op, intra-op, and post-op follow-up with our patients, education, workup, clearance for surgery, and we like to follow up the patients long-term to make sure that they're nutritionally up to par, they're maintaining their weight loss healthily.
Okay, and you're here with the Hazleton Health and Wellness Center located in the building.
Yes.
And you are part of the Greater Hazleton Health Alliance.
Yes.
And you've been doing these surgeries for how many years?
In the region, well over 10 years, but I've been doing it for almost about 20 years now.
Okay, and you've seen great success with this?
Yes, yes. When carefully done and good patient follow-up, we've had some real life-changing events. It's a lot of fun.
Well, thank you, Doctor. If you would like any more information from Dr. Bono, you could reach in here at his office at the Greater Hazleton Health and Wellness Center. And for this week's Health Check, I'm Deb Lissant reporting for Channel 13.